Selecting an orthodontist for you or your child can seem like a big task. This video, presented by Julie Staggers Orthodontics, is designed to help make this selection process easier. There is no substitute for a well-trained, experienced orthodontist. Make sure that your doctor was trained at an accredited university residency program and not at a weekend motel course. In order to become an orthodontist, a dentist must attend a 2 to 3 year orthodontic residency program after dental school. Only doctors that have completed a 2 or 3 year orthodontic residency program can legally call themselves orthodontists. Orthodontists must restrict their practices to orthodontic treatment only. Dentists who provide services other than orthodontics are not orthodontists. It's very important to understand who is providing your orthodontic care. In Virginia, general dentists are legally allowed to provide orthodontic treatment to patients provided that they do not misrepresent themselves as orthodontists and as long as the treatment provided is at the same level as the care that would be received in an orthodontic office. Minor orthodontic problems can be adequately treated by general dentists. As a consumer, you must make sure that your doctor that you select, whether it's an orthodontist or a general dentist, has sufficient training to correct your particular orthodontic problem. The best way to determine the type and length of your doctor's orthodontic training is to ask them. Orthodontic treatment fees are based on the type of orthodontic problems that are present, the severity of those orthodontic problems, and the time needed to correct the orthodontic problems. An orthodontic fee that is presented to you that appears to be too good to be true probably is. Most people don't think of doctor's offices as being businesses, but in reality, they are. The fees that you pay for your orthodontic treatment must cover the business costs of your orthodontic office. Extra or free services, products, and prices are incorporated into your treatment fee. In order to keep fees affordable, Dr. Staggers' office does not offer coupons, games, gimmicks, contests, prizes, and scholarships that only benefit a few patients. Lower fees benefit every patient. Every orthodontic office has their own fee schedules. It pays to price shop. Not everyone who comes to the orthodontic office needs braces. Some patients' teeth are normal with a good bite and they don't need braces. Other patients are too young with insufficient permanent teeth erupted to have braces. If your child is too young for braces or doesn't need braces, Dr. Staggers will let you know at your consultation appointment. If your child is too young for braces, Dr. Staggers will place you in a recall and will periodically check your child's teeth for the need for braces in the future. When selecting an orthodontic office, make sure that the office schedule is compatible with your schedule. Ask what the office hours are and if they change during the summer months. Also ask how after-hours emergencies are handled. All orthodontists realize that evening and weekend hours are convenient to patients and parents. However, delivering orthodontic treatment is a team effort between the orthodontist and the dental assistants. Most dental assistants are women with family responsibilities. Well-trained, competent dental assistants are usually unwilling to give up their family time in order to work weekends and evenings. Therefore, very few orthodontic offices offer evening and weekend hours. Do your homework before you select an orthodontist. Orthodontic treatment requires a long-term relationship between the orthodontist, the patient, and the parents. Spend some time making the right choice. Ask your friends what they liked or disliked about their orthodontic treatment experience. If you feel pressured to commit to an office during the consultation before you're ready to make that choice, don't sign up for treatment. In the modern world, convenience is king. The fast food model of delivering products and services is being applied to everything, including healthcare. Who wouldn't want that? A healthcare provider on every street corner who is open nights and weekends, and just like our favorite fast food place, we can go in and tell the doctor behind the counter just what kind of healthcare we want and how we want it. The problem with this is that not everything can be adapted to the fast food business model, especially not healthcare. When you go into a fast food burger place, the person behind the counter is tasked with getting your burger as fast as possible, made with the condiments that you want, and yes, take your coupons. That fast food worker is under no obligation to tell you whether or not you should be eating that high-calorie, high-fat hamburger. He or she doesn't care whether you have high cholesterol or heart disease that can be made worse by that hamburger. He or she just takes your money and attempts to satisfy you so that you will keep coming back for more burgers because that's the job, to sell hamburgers. Never mind the effect that it has on your health. Doctors are not fast food workers that can simply give you what you ask for and ignore what you don't. Doctors are ethically and legally obligated to tell you what health problems you have and what your treatment options are. Sometimes doctors have to tell you what you need to know rather than what you want to hear. In our rush to have convenience and to have it my way in healthcare, we are sacrificing one of the main purposes of our doctors, which is to evaluate our problems and to make appropriate treatment recommendations, whether or not the treatment recommended is a convenient one or the one that is seen in a TV advertisement. The purpose of advertising and marketing is to sell a given product, whether or not it is hamburgers, pharmaceuticals, magic orthodontic brackets, or clear aligners. Companies that make these items want to sell their products and are not tasked to whether or not these products are appropriate for you. That is why you need an orthodontist to help you evaluate what your orthodontic problems are and what treatment options are most appropriate for your particular problem. Not every child needs 2 phases of orthodontic treatment. Children with significant orthodontic problems at an early age, between 6 and 9 years old, may require 2 phases of orthodontic treatment. The goals of Phase 1 treatment, which is also called interceptive treatment, are to improve growth discrepancies between the upper and lower jaws, to correct immediate dental problems that may be present, such as cross bites, open bites, and severe dental crowding, and also to minimize the developing malocclusion. After Phase 1 treatment, a child may need a second phase of orthodontic treatment at a later time once the majority of permanent teeth have erupted. Phase 2 orthodontic treatment usually involves a full set of braces or upper and lower clear aligners with the goal to align the teeth and perfect the bite. Whether or not a child needs a second phase of orthodontic treatment depends on the size and the position of the teeth that erupt, the manner in which the teeth fit together, the effectiveness of Phase 1 treatment, and the dental expectations of the child and the parents. Successful completion of Phase 1 treatment does not guarantee that the teeth will erupt in perfect alignment and in good occlusion, but it may make Phase 2 optional. However, if the child and the parents desire perfect tooth alignment and an ideal bite, a second phase of orthodontic treatment is usually necessary. Not every child requires 2 phases of orthodontic treatment. Mild orthodontic treatment can be treated with a single phase of orthodontic treatment. Severe orthodontic problems that are treated with 2 phases of orthodontic treatment may produce more aesthetic and more stable orthodontic results than if only 1 phase of orthodontic treatment is done. I hope you found this video helpful. Please give us a call at Julie Staggers Orthodontics if you have further questions. We are really looking forward to being your orthodontic office.